Well, countries like the Bahamas and others, such as our closest neighbors, the United States, are engaging in a phased reopening strategy to reduce the number of COVID-19 cases. Just this week, the director of the Pan American Health Organization, Carissa Etienne, asked countries to analyze specific trends in the COVID-19 pandemic according to their unique context. She warned that reducing social distancing measures too soon could accelerate the spread of the virus and open the door for a dramatic upsurge. We asked PAHO country Representative Dr. Esther de Gorval to speak to local concerns about the reopening.
Has to do with the risk of an outbreak that is not brought under control, and in terms of opening the borders for international travel, the risks of reintroduction of virus from countries that are still experiencing outbreaks. You would have seen in the international news many countries with different outbreaks occurring in different parts of the country. Most notably, the information that comes out of the U.S. with large numbers of cases in New York, for example, whereas other states may have lower transmission going on. So it is really important to look at all the possibilities for transmission within the country, as well as the possibilities for reintroduction of virus if you've brought your outbreak under control.
Well, Dr. de Gorval says this is important as the Bahamas is in the process of a phased reopening, keeping in mind its geographical makeup.
The data at the moment suggests that most of the transmission is occurring in New Providence. A few cases occurred in Grand Bahama, one recently this week. And as of earlier this week, Bimini emerged as a hotspot with, I believe, up to 8 cases so far detected on Bimini, whereas the rest of the islands in the archipelago have not reported any cases. Cases have not been confirmed there. So you would have heard the plan to open up activities in a phased way, with the southern islands of the Bahamas being the first to be allowed to conduct activities with freer movements of people. And I think this is precisely what the director of PAHO had in mind in terms of looking at the epidemiology, looking at how your outbreak is evolving in order to take the safest possible decisions about reopening.